It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is cataract surgery, and joining me is Dr. Jason Darlington with the Eye Institute. Welcome, Dr. Darlington.
Thank you for having me, Joe.
It's a pleasure to have you. On the previous show we did with Dr. Mandisi of the Eye Institute, Dr. Mandisi brought out something that I think is extremely important for having the purpose of these television shows that we do on all aspects of helping seniors. And he hit the educational part of it. And I thought that was so important for seniors, especially. I think that most of us tend to neglect the care of our eyes probably more than any other part of our body. Would you have a comment on that?
I would agree with that. And the tricky thing about some of the eye diseases that we can develop is that they are asymptomatic, meaning we can't see the difference. Even though a disease process might be damaging our eyes, we cannot feel it. And by the time we can see or feel the disease process, it's too late. And so it's always important to get routine eye exams to make sure that one of those disease processes is not happening to the eyes.
But even though you said it's too late, my own experience in talking to very, very many eye doctors is that there are only a few things, well, I won't say few, but there are some things, there are a lot of things that can be reversed, a lot of things that can be helped, but there are only a few. Like if you let glaucoma go too long, it's called a silent killer.
That's correct.
And you're not going to reverse glaucoma.
All we can do is prevent further damage. That's correct. We
Right.
cannot go back in time and undo previous
Right.
damage.
And if people understand macular degeneration, whether it's the wet type or the dry type, you can help the wet type more than you can help the dry type.
Correct. That's correct. And some folks feel like even though they have been diagnosed with the dry type, they feel like, well, we can't reverse that. So they tend to, maybe think they can let that go. What some folks don't understand is the dry can convert to the wet. So it's still important to keep, retina exams and all your appointments going, because we can detect the wet type of macular degeneration as it develops and catch it before it turns into a major problem with the eye and major vision loss.
You just made, I don't know if, I'm also hard of hearing and I wear hearing aids, but I think I heard you say something about dry macular degeneration can revert to wet?
Correct.
Well, that would be a good thing.
It's not a good thing. The good thing about wet is that we do have some novel treatments that we can reverse wet changes, but it's better to catch those changes very early and treat the wet early, as opposed to waiting for a major bleed or a lot of fluid to damage the retina and treat it after the fact. So if you can catch the wet early and treat it early, that's a good thing.
Okay.
But we don't want the wet to go untreated, because that can lead to very rapid visual loss and deterioration.
Okay. So the title of our show today is Cataract Surgery. And I would really like for our viewing audience to have a really nitty-gritty understanding of what cataracts are, how they can be treated, and what some of the dangers that we perceive as dangers are not really dangers. Before the show, you and I both talked, and you've made me aware of it. I have a different awareness of what can be done with cataract surgery. Can you help those people on the other side of that camera understand that?
Sure.
Go ahead.
Well, there are two major focusing structures in the eye that help our eyes see. So when we're looking at a distance object, for the most part, the light rays are traveling in parallel rays.
Okay.
And so there's a front cornea and then there's a lens inside of the eye. And it's the job of those two structures to get all that light to focus onto the retina, and that's how we see. For a lot of folks, we don't have the light focusing perfectly on the retina, so people need glasses or contact lenses to get that light to land precisely on the retina to maximize the vision. When you have a lifetime of light traveling through the cornea and the lens can sustain aging changes, sunlight damage. The proteins denature. And so instead of that lens being perfectly clear, it gets cloudier and cloudier, and that's what a cataract is. A cataract is when the clear lens inside of our eye is no longer clear. It clouds up. And you can imagine that if you put a perfectly brand new pair of glasses in front of that cloudy lens, that cloudy cataract, the image still has to pass through the cataract. So the resulting image in the back of the eye is still going to be cloudy. And so when people go in for their eye exam, sometimes they're surprised in that no matter what type of better one, better two, no matter what type of glasses that they're presented with, the image is not sharp. And that's because it's not a problem with the glasses, it's a problem with the cataract and the lens inside of the eye that's cloudy. And so once we're not able to correct the vision adequately with glasses, that's when we start talking to folks about cataract surgery and trying to sharpen and brighten the vision.
Okay. Exactly what is a cataract?
So cataract is the clear lens inside of our eye, one of the two focusing structures in our eye that clouds up. The reason why we're not able to keep our lenses clear throughout our lifetime is that most of our body, all of the cells in our body have DNA and Golgi apparatus and all these different structures that help keep those cells healthy. We can create new proteins. We have the DNA in our cells to call upon to fix and repair our cells. Well, when our lens developed, for the lens to be clear, the lens needed to get rid of all of that machinery. So it got rid of the ability to make new proteins. It got rid of all the DNA structure. And so really what all these little lens cells are, most of them are clear little cells with protein fluid inside of them. And they have very little machinery left. And so once you have a lifetime of light, all this UV radiation passing through these clear little cells with protein, the proteins become denatured and the lens sustains sunlight damage and it is not able to repair itself. It cannot clear itself up. And so these clear lenses slowly turn more yellow and more yellow and get cloudy.
So you, Dr. Mendesi, and I had on a recent show, I had a periodontist, and a word that all three of you used repeatedly was protein.
Mm-hmm.
What is the connection or what is the significance of protein in our body? And maybe it's not a fair question to ask you as an eye doctor, but I suspect it might be. Why does protein play such an important role in the eye, the mouth? And I know that protein is often measured in terms of determining cancer. What is the significance there, or is there one?
Well, proteins are very important. One of the things that keep our eyes healthy are antioxidants. And the purpose of antioxidants are to help prevent the protein and the DNA in our eye structures from becoming denatured and from sustaining aging changes as we live. And the healthier we can keep the DNA and keep the protein, obviously the healthier our eye structures or our mouth structures or all of our organs in our body.
If I ask you the question as an eye doctor, what would you tell a person to do about having a better balance or more of an abundance of protein in the body? Is that eating red meat, or is it what? I have talked to a dentist, and I've got his take on it a little bit. But as an eye doctor, how do you feel about people being more aware of their protein intake as it affects good, healthy eyes?
Sure. I think that it's important to eat everything in a balance. You don't want just the protein. And one of the really important factors to keep in mind are healthy oils and micronutrients. So leafy greens are very, very important at keeping your eyes healthy, especially for the retina structures. And fish oils are very important at keeping a very healthy ocular surface, which is the tear film and structures that make up the tear film.
Yeah.
And so there's often times in clinic where I'm recommending to folks to take eye supplements or eye vitamins to help with their retina structures. Sometimes I recommend to some of my patients that they take fish oils to help with the surface structures of our eyes. And so, depending on the clinical scenario, sometimes I do have dietary recommendations for my patients.
I just wonder how many people watching this show have ever thought about taking supplements to improve the health of their eyes. I don't ever, even, no. That's the ultimate mouth manual Dr. Sheldon wrote. Maybe find a good book on eye care. Is there such a book?
There are many, many books on eye care. I've got a library full of them.
Okay. Let's get back to cataracts and I'll ask you questions pertaining to myself so that those viewers can understand what it is that I'm concerned about, and you're going to help me take that worry away. I have a cataracts, and I think you've determined that the type of cataract I have is something that if they're taken off, there's a chance that I could have to have additional surgery. And can you explain to our audience some of the concerns that people should have that have cataracts, alleviate some of the concerns they have about whether or not to get that surgery done, and
Sure.
and how simple some of these things have become, but that's your field. But those
Sure.
are my questions.
Sure. Usually, when I'm seeing someone about their cataracts and about cataract surgery, the initial consultation, almost everyone is very concerned about the process of having a surgery on their eye. And everyone's had something fly into their eye. We all know how sensitive our eyes are, and the idea of having a surgery on your eye is very frightening for a lot of folks.
It is to me, yes.
And I'm sure it is. And so part of the educational process of talking to folks about cataract surgery is to try to alleviate the fears and try to make them understand what it is we're doing and how safe the procedure is for most people. In terms of the cataract surgery, it has evolved over the past 30 to 40 years, and it's gotten to the point now that it's about a 10-minute surgery. We don't have to perform general anesthesia on folks. People are awake, breathing on their own. We do give some IV sedation to help people stay nice and relaxed. We numb the eye topically, and at the end of the 10-minute surgery, most people walk out of there and they're feeling quite good.
Are they sitting up or laying down?
Laying down.
Laying down, and you use a topical agent to numb the eye?
That's correct.
I think it was Dr. Palmer.
Mm-hmm.
That used to be with the Eye Institute. Talk about going into the eye, cutting on the eye, going into the eye, and you can numb that up. So
when you go in and have your eye exam, they've touched the surface of your eye before, but you may not be aware of it because you can't feel it. So we have very, very effective topical medications that completely numb the surface nerves of the eye. And so when you go in, even for your routine eye exam, we check the pressure, and then how we do that is we touch the surface of your eye, but you don't feel it.
No.
And once the numbing drops wear off, you're not aware that anything was ever there. And it's a very similar process with the eye surgery, depending on what kind of eye surgery we do, but specifically cataract surgery. The topical numbing medications are able to completely anesthetize the eye so that the surgery itself is very, very easy to tolerate.
Right.
And I can tell you that with the initial consultation, people are very nervous about the idea of having cataract surgery. And once we go in and talk about having their second eye done, almost everyone is looking forward to it, believe it or not.
You only do one eye at a time.
That's the standard of care, one eye at a time.
Have you ever done two at a time?
I have, but that's very, very rare. And usually in those situations, It's a situation in which the person needs general anesthesia for some reason. And if we have to perform general anesthesia, endotracheal intubation, the risk of that is higher than the risk of the cataract surgery. And so in those situations, I'll do both eyes.
Okay.
Usually we do one eye at a time, let it heal, go ahead and do the second eye a week or two later.
This may not be the time to ask it, but I mean this strictly as a joke. You can't do acupuncture on an eye, can you?
Not exactly.
I had to ask you that. I don't know why I wanted to do that, but I wanted to ask you that. But getting back to seriousness now, let's say you're a surgeon, and that's what you do. You remove the cataracts, but when you get into this business of replacing or doing a corneal implant or doing a retina replacement, what are the dangers involved there, or has the process become such that most of the old-time fears have gone away?
Well, like I mentioned, the evolution of cataract surgery has been dramatic, and 30, 35 years ago, we would have to open the eye almost in half. We'd have to detach half of the cornea, lift it up, take the cataract out in one huge piece, and then sew the eye back up. And because the eye was fragile after a surgery like that, people would have to be admitted to the hospital, watched for a week. They'd have to not move, not lift, not bend, many restrictions while the eye recuperated. These days, we're able to do the entire cataract surgery through a 2-millimeter wound, which means there are no sutures. The eye heals very quickly. It's not uncommon for folks to have perfect 20/20 vision the day after surgery.
How do you get it off?
Now, I try not to have people expect the 20/20 vision after surgery, but it's always great when that happens.
Yeah.
But most people recover within the first week and have excellent vision in 1 week.
Yeah. I can't imagine the ease with which you talk about cutting an eye in half and lifting it over. I always thought that the eye, if it was pierced, was a jelly type thing, that the eye ran out. Huh? Have you heard the same thing?
There is vitreous gel in the back of the eye. When we are doing cataract surgery, we don't involve ourselves with the back of the eye. So it's all the surgery is done in the front. And it's true that if we just made an incision in the front part of the eye, the fluid would rush out and the eye would tend to get soft and maybe even collapse a little bit. And luckily, we have surgical instruments. And one of those instruments is a clear jelly. It's called viscoelastic agent. And so when we put that into the eye, it's thick enough that we can go in and out with our instruments through the micro incisions. But because the jelly is thicker, the jelly doesn't flow out of the eye. So the eye always stays nice and round and full.
Okay. If you can illustrate, when we're talking about this surgery, when you take a cataract off, are you talking about something, maybe you're working on something this big, or is it bigger than that? Or how much of an area are you working on?
The cataract itself is quite large in comparison to the size of the wound that we make. The reason why we're able to get the cataract, a large cataract, which can be 11.5 or 12 millimeters in size, and we're able to get that out of a 2-millimeter wound, is because we have something called phacoemulsification. And so what that means is phacoemulsification is the device used to break the cataract up and remove it from the eye. One way to think of phacoemulsification is a small vibrating metal straw.
Okay.
And so that small vibrating metal straw vibrates ultrasonically, and as it's vibrating, you touch it to the cataract emulsifies, it breaks up. And then the straw is always sucking in through the port, and so as you break the cataract up into pieces, it removes it.
That was what I remember. I had one time. We were talking about the type of cataract I had. That if they did that when they did that sucking, they would pull the stuff off of my retina or the cornea. Is that?
Probably what they were talking about is the more advanced the cataract becomes, the more energy or the more ultrasound that we need to break the cataract up.
Okay.
And if the cornea is already compromised in some way, if the patient doesn't have a lot of endothelial cells to begin with, then the more energy and the more fluid going through the eye, the more the endothelial cells will become damaged at the time of the cataract surgery.
Okay.
But luckily, we have the ability to replace endothelial cells if the eye needs it.
You can replace them?
A corneal surgeon is able to do that.
So what you're saying is that an experienced surgeon, if it goes into the eye and fully understands the condition of the eye itself, you stand a much better chance to correct almost anything with today's techniques.
The wonderful thing about cataract surgery these days is even for folks that have needed glasses and been dependent on glasses their entire life, we're able to neutralize, not only get rid of the cataract, but neutralize the refractive error. Refractive error is being dependent on glasses. And so let's say you've been nearsighted your entire life. We can take your cataract out, and instead of putting the same power lens back in your eye, we adjust the power of the lens in your eyes. So we can get rid of your distance glasses or get rid of distance and near glasses. And so we're able to put in a regular lens implant. We can neutralize astigmatism with special toric lenses, and we can put in even multifocal lenses, we call them. Multifocal lens is a lens that gives you distance vision and near vision simultaneously. And for a lot of folks, they don't need glasses at all after a multifocal lens.
Wow. You mentioned, I read in some of the material you sent to me, you were talking about at the time that you do the cataract surgery, you can determine whether or not they need to replace the lens?
So by definition, cataract surgery is we're taking the cloudy lens out and implanting a perfectly clear lens. So we're always replacing the lens with cataract surgery.
You actually take the lens out and put a new lens in?
Correct. So the phacoemulsification is the act of breaking up the natural cloudy lens. And then once that is complete, once we've cleaned everything up, then we inject the perfectly clear lens back into the same exact location where that cloudy lens used to sit.
Okay. Another thing you talked about in your notes to me was the eye stent.
Correct.
What is, I found it kind of intriguing talking about putting a stent in an eye. What is that? How do you do that?
Well,
or what is it first to start with?
For most of folks, they don't have just one eye problem. Some folks have cataract with macular problems. Some folks have cataract with glaucoma, cataract with cornea problems. And so there are often times where if we need to go to the operating room to fix, let's say, the cataract, we will use that opportunity to maybe treat some other diseases of the eye.
Okay.
And that might be astigmatism, farsightedness, nearsightedness, or in the case of eye stent, we're able to treat glaucoma. Now, what the eye stent is, it's the smallest FDA medical device ever approved. And what the eye stent does is at the time of cataract surgery, once I've taken the cataract out, once I've put the proper lens into the eye, I can put this micro device into a structure of the eye called the trabecular meshwork. And once the device is in place, it allows the fluid better access to the natural drainage structures of the eye, and that helps lower the pressure some. And so for approximately 60 to 80% of people that are dependent on glaucoma drops to keep the eye pressures controlled, after having the eye stent placed, they're able to reduce their dependence on drops.
Do you find that placement of an eye stent is becoming more prevalent in your work or not?
There are not a lot of surgeons that are implanting the eye stent at this time. It's a fairly new device. I'm fortunate enough to have trained with the person who brought this device to market and helped with the FDA trials and getting it passed. And I'm one of the like I said, the few surgeons that use that device.
You can do this at the Eye Institute?
I do this at the Eye Institute for any of my glaucoma patients that have cataracts.
That must be a godsend for glaucoma patients.
It's wonderful, and not only are we able to help lower the pressure. It's much easier for patients if they go from 2 drops to 1 drop, or maybe from 1 drop to no drops. It's healthier for their eye in the long term, better for their optic nerves, and the less dependent we are on medications in general, the better our standard of living is.
Okay, so if a person, you put a stent in the heart, And that keeps the wall of the artery open so the blood goes through.
Correct.
What does this eye stent do?
The way that the pressure is controlled in the eye is there's a structure called the ciliary body. It's right behind the iris, right behind the color part of our eye. That's the structure that makes fluid. The fluid flows to the front part of the eye, and the fluid has to go through a structure called the trabecular meshwork. And the trabecular meshwork limits the flow of fluid to get into the rest of the drainage structures of the eye, or Schlemm's canal. And so what we do is we put a stent through the trabecular meshwork. It allows the fluid to bypass the trabecular meshwork and flow directly from inside of the eye to the drainage structure. So if we're bypassing the site of highest resistance, then it can help decompress the pressure and get the pressure back into the normal range. And if the fluid has easy access to the natural drain, then you may not be dependent on drops trying to suppress the amount of fluid.
And that was one of the problems with glaucoma, was the overpressure.
Too high of a pressure for the, that's correct.
So the eye stent relieves that pressure.
That's exactly right.
You've got 18 seconds. What would you advise our people to do, our viewing audience to do? Tell them real quick.
I would advise you to make sure that you keep your eyes healthy, and the best way to do that is with routine eye checks, because glaucoma, as you mentioned, is a silent killer, so we don't know if we have it unless we have an eye exam, and that's probably the most important thing I can say.
Okay, we're out of time. Thank you, doctor, and I really appreciate what you have told these people. And I want to thank you, viewer, for watching today's episode of Helping Seniors, and I hope you've learned something. I have, and I've learned not to be as afraid of maybe looking at getting my own cataracts taken off. Thank you.